Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, some of the highlights. Today, more COVID-19 infections as confirmed cases in Nigeria nears the 9,000 mark. The health sector comes under review as President Buhari begins a second year in his second term. And it's a crisis situation in South Korea as authorities shut down schools after reopening just a few days ago. As Nigeria marks 21 years after military transition to democracy, the question of good governance has been a recurring talking point, especially when it comes to getting the dividends of democracy to Nigerian citizens. Today, the task of governance regarding the state of our health sector comes under focus as the country witnesses another May 29 in its national calendar. Over the years, there have been no love lost between Nigeria's Health Workers Union and the federal government, with so much left to be desired in Nigeria's health institution. 4 years ago, it was the Ebola virus epidemic, sending a warning shot on the need for government to put its house in order regarding its health sector. Today, with the reality of COVID-19 in the health space almost shutting down our national life, exposes again the fragile state of our health sector. And going forward, how can this trend be reversed? Well, that's what we'll be looking at as our theme this afternoon. Meanwhile, today, May 29, the All Progressives Congress-led administration of President Muhammadu Buhari clocks 1 year in its second four-year term and the fifth year of the government in office. The date used to be observed as Democracy Day in Nigeria, marking the day the military handed over power to an elected civilian government in 1999, and the beginning of the longest uninterrupted civilian rule in the country's history since independence. That, however, changed in 2018 after President Buhari declared June 12 as the new Democracy Day to honor the late businessman and politician Moshood Abiola, who emerged winner of the presidential election of June 12, 1993, but which result was nullified by the military government under General Ibrahim Babangida. In the meantime, the presidency has been giving its scorecard in the past 5 years, insisting that it has performed well in areas in which the administration promised change, and that is tackling insecurity, reviving the economy, and fighting corruption. Well, our State House correspondent Ibrahim Adra is at the presidential villa now, and he joins us for more. Hello, Ibrahim. The presidency is marking the end of its first year in its second term in a pandemic. It must be a different atmosphere at the villa today, isn't it?
Melissa, you couldn't have put it any better. That exactly is the situation. It's totally different from what you would have expected on a day like this. I mean, years before now, or even last year. It's pretty quiet. From in here, you wouldn't know anything is happening. As you know, there are instructions, there are rules before now guiding how many people come to work and to what offices. Only senior officers according to the guidelines that were released earlier on. So yes, this place is pretty much quiet. Not much is happening as far as activities and hustle and bustle of everyday usual governance is concerned. No thanks to the COVID-19 pandemic.
The Presidential Task Force on COVID-19 has been at the forefront in the fight against the pandemic with its regular updates. But what more can Nigerians expect from the Buhari-led administration, especially as we are still facing, more cases in the COVID-19?
Melissa, that wouldn't be a question for me to answer directly, but then if the president's pronouncements, if his statements before now are anything to go by, you expect a whole lot more. Whether that would happen or not is another matter altogether. But then he has said at several fora that he wouldn't spare anything to make funds available to relevant agencies, the task force particularly, to do what it has to do to stop the spread of this virus. lives, as well as ensure the healthy living of Nigerians. So as far as that goes, we would only have to wait. And of course, he will be relying, I guess, a whole lot on the presidential task force that appears to have a whole lot of power and the president's backing 100% to do what it has to do when it has to do it, and then see where there are recommendations and then put to the president for him to instruct and direct that they are implemented. But for now, the PTF will be at the forefront of the fight as far as the Buhari administration is concerned. Whatever it does, and recall only on during the Eid al-Fitr celebration when he was speaking after observing prayers here in the villa, he did commend the Minister of Health and says they are doing a wonderful job. And as you know, the Minister of Health is also part of that task force. So you would say it appears he is very happy with what they are doing, and if whether or not some new things will happen would depend to a large extent on the recommendations of the PTF.
And finally, before we let you go, Ibrahim, with the new date of Democracy Day, now June 12, are we hearing as to how that day will be celebrated?
Oh, well, there is still list, but if there are preparations, I guess officials are keeping it close to their chest at this moment. We don't have any confirmation as to what would happen specifically on that day. Whatever information there is, usually the tradition is that a timetable of what activities will happen, pre June 12th and perhaps on the day proper is something that will be released officially, and so it would be wrong to begin to speculate at this time. We just hope that whatever program they have would come out and Nigerians will know way ahead of time and also fit their programs around those activities.
All right, many thanks, Ibrahim Adra, our State House correspondent, joining us there. And in Lagos, frontline health workers got some accolades from the Lagos State Governor, Babajide Sanwo-Olu, for their contributions in the fight against COVID-19. As part of the one-year anniversary of the State Governor, he acknowledged the role of health workers, saying that he is confident that Lagos State will come out strong in the battle against COVID-19.
We're indeed happy that we can do this to you this morning, and we're saying that whilst we continue to push the narrative around COVID-19, we believe that we will surmount it. We believe that we have a team that is dedicated at ensuring that this pandemic blows over. When it will, we will all be here to see to the end of it. And I want to thank you and commend each and every one of your senior officials that are here, the permanent secretaries, the CMD, your commissioner, and everybody that have been working with our government on this journey.
Nigeria yesterday recorded 182 cases of COVID-19, one of the lowest numbers of cases in a single day, but that brings the total of cases to 8,915. The new cases were confirmed in 15 states and the Federal Capital Territory, with Lagos having 111, the FCT 16, Akwa Ibom 10, Oyo 8, Kaduna and Delta 6 each, Rivers 5, Ogun and Ebonyi 4, Kano 3, Plateau, Gombe and Kwara 2 each, Kebbi, Bauchi and Borno each have 1. The breakdown of the figures, looking at it regionally, shows Lagos in the southwest maintaining the highest number, 4,123 cases, followed by Kano in the northwest with 939. The FCT is the next highest, the highest in the north-central region, maintaining the figure 535 cases. Borno leads in the northeast with 258, Edo in the south-south with 240, and Ebonyi in the southeast with 40 cases now. Well, joining us right now is Dr. Adoyi Omale, a public health physician. We'd like to welcome you to the program.
Thank you very much. It's my pleasure.
Now, we're seeing more and more cases each day. How would you say our healthcare systems are holding up?
Well, our healthcare system is trying to cope with the situation as it is. A lot has not been put, a lot of things that are needed to be put on ground were not there before now. Government is just trying to bring a lot of equipment into the country through the Presidential Task Force and the Federal Ministry of Health. And it's now glaring to Nigerians that traveling abroad for medical attention is not the way to go. We have to make our facilities to work here. We had the issue of a former governor of Borno State. The son came on air and was complaining that the father took ill and he was taken to the hospital, and they didn't see a lot of medical personnel they were supposed to meet in the hospitals. So I think the reality has now dawned on us as Nigerians that we have to make our health system to work rather than relying on medical tourism, traveling abroad when we have minor ailments.
Dr. Male, what's your assessment of the efforts of the Presidential Task Force, especially the response to the outbreak in Nigeria?
I think to be fair to the Presidential Task Force, I think they have tried. They have tried, especially in terms of the daily briefing, which they have been giving to Nigerians. But I have seen little efforts by government agencies, especially NAFDAC and some other agencies that are supposed to be involved, especially in terms of getting the requisite traditional medicine and other things that will help to curb or to facilitate the early cure of this disease, especially the efforts by our local scientists and the rest. I have not seen enough, other than the briefings which we get. I have not seen a very proactive approach, especially in terms of testing. We are still struggling to get a lot of Nigerians tested. And if you look at a lot of complaints from Nigerians, especially those who want to be tested, they are not getting the opportunity. They cannot just walk into a medical facility and get tested. And I heard the Lagos State government saying to test one person is about 50,000 naira, which to me is out of the world. So we have to devise a means that we have to do massive testing in this country. And to me, on that scale, I don't think the Presidential Task Force have done much. But they have done a lot in terms of information dissemination, in terms of public enlightenment, in terms of daily briefings, as we can see. But in terms of real practical testing, we have not seen a lot being done in that regard.
But Dr. Male, in terms of testing, are you saying that they should change their case definitions? Because they've talked about funding as a major challenge in this, and they're working with what they have, and also with the case definition that they brought out, testing, tracing based on some of those guidelines.
I think they should take a cue from Senegal. Senegal has been able to develop a homegrown testing kit or testing mechanism. I learned that our own National Biotechnology Center had also done gone a long way in doing a research into these testing methods. They should approach the Senegalese through our cooperation in Africa to see how Senegal were able to do it and some other countries, so that we can leverage on that. But because as it is now, we are not testing enough. That is the fact. And the Presidential Task Force should concentrate on how Nigerians can have access to this testing. It's only when you test that we can be sure, because these figures that are being rolled out every day are those that either have symptoms or those that have been tested randomly. Those are the ones that we are saying. And even these tests that have been carried on, a lot of people, take for example the case of Susan Okpe from my state, who is up to now is still disputing the authenticity of the test results that NDDC is churning out. I think a lot of Nigerians are worried about the quality of or the results that these tests are bringing out. And there's a lot of cynicism and there's a lot of mistrust on the issue of the authenticity of the results that are coming out from the NCDC. Because For example, the case of the Susan Okpe, the haste in which it was announced shocked a lot of people. And up till now, I hear that they say she tested positive, but they still release her. All this controversy has cast a lot of doubt on the results that have been churned out.
All right, Dr. Adoye Male, public health physician, joining us from Abuja studio. We'd like to thank you for joining us on the program.
Thank you very much, ma'am.
We have more on our healthcare system in the COVID-19 era when we return. Welcome back. According to the World Health Organization, people must be prepared for new outbreaks of coronavirus to build up very quickly. The body's COVID-19 special envoy is warning that this virus has not gone away despite lockdowns being eased. Well, joining us now to talk about this is a public health physician, Dr. Opeyemi Osunyomi. Thank you for joining us on the program.
Thank you very much.
I'd like to begin by asking our healthcare systems. We've been told that it's not positioned to handle this type of pandemic, but so far, are we moving in the right direction?
We might say we're moving in the right direction, but there's a lot. Just like the previous speaker said, COVID-19 actually exposed Nigeria. It exposed the kind of health system that we have, that we've not done much since independence. I want to say maybe we've even gone backwards, with the exception of maybe Lagos. Lagos State is the only state I could say is trying a bit, and maybe Ogun State. But all the other states, I served in the north, and I could remember how it was. It was not very nice. So this has really exposed us. We're trying, we're making efforts, but we still have a long way to go to really improve on our healthcare system in this country.
In terms of workers' welfare, we're seeing different things. We're getting different reports from Kano, from health workers in Kaduna complaining about their salaries that are being deducted, and yet they're still supposed to fight in the front line. Hearing all of this, do you think state governments are prioritizing health workers at such a time?
No, they are not. One of the reasons why I will say that, maybe, I don't know, people may think I'm a bit biased when it comes to Lagos State, but it's just the true fact of what I've seen. Lagos, I will still say, is the state that seems to be fair in prioritizing healthcare compared to other states. Healthcare has never really been in the forefront for most of the states. And the welfare of the health workers has been poor. It has been poor, and that's why we've had a lot of brain drain in the past. In fact, it's been the brain drain we've had in the last couple of years is almost twice what we've had in the last 10 to 20 years.
Among health workers? Among
health workers. People are leaving. Nurses, doctors, even community health workers, you can imagine. They're supposed to serve us at the basest level of the community. They are leaving the country. Medical lab scientists, medical lab technicians, they are living in droves. And it's just because the welfare package is nothing to write home about. They don't mind going to write the entry-level exam for them to be able to practice abroad. That's after spending 6 to 7 years for doctors, for 3 to 5 years for nurses and other healthcare workers. They still don't mind going to start all over again so that they could practice abroad because the welfare package is very good.
All right, so I guess we should be, hoping that government would take a look into all of these measures and ensure that our healthcare systems don't suffer.
Let's hope so.
We appreciate your time, Dr. Opeyemi Osunyomi, a public health physician. Thank you for joining us.
Thank you very much.
And right now, we have joining us from Berlin, Deutsche Welle correspondent Stephen Barrett. He joins us via Skype. Hello, Steve. Thank you for joining us. How are things looking up in Germany? This is following the relaxation of lockdown. We're hearing South Korea closed its schools soon after it reopened, after more clusters of coronavirus were recorded. But is there more progress in Germany?
It's still early. Schools have reopened just a few weeks ago, and they're only doing it stage-wise. That is, only certain classes are allowed to go in right now. Also, kindergartens here, which are a very important element of daily life, that is daycares, they're reopening slowly, bringing in kids of a different size, of different ages, rather. So far, we have not seen clusters coming up. We have not seen any rise in infections that has been concerning. So, so far, so good, you would say. And even we're seeing from virologists that perhaps a second wave of cases, as many had expected to arrive in the coming weeks, they're now sort of distancing themselves from that model and saying it could be later, maybe in the fall. So right now, things seem to be on the right track, but as they're more loosening regulations, it's hard to say. There's a plan now to open bars, for example, in the coming week, to lift the cap on demonstrations. All of these could contribute to further infections. We just don't know.
Steve, earlier in the week, we heard about the EU recovery package proposal by the Commission to help tackle the crisis. It seems really promising, but how do they plan to get all 750 billion euros? Are they all loans, and how are member states reacting?
Yeah, 750 billion euros is the plan for how much they're actually going to borrow. And what's interesting about this is that normally EU states have been very hesitant to borrow amongst themselves for the benefit of others. They consider that transfer of money, and that sort of goes against a lot of the constitutional premises of the EU, and states just don't like it. What this plan would call for is the EU itself, basically Brussels, to borrow on the open market 750 billion euros against its own budget as collateral. So countries are less exposed there. There is still some joint debt, so there's still controversy. But 500 billion euros of that would go to grants, that is money that doesn't have to be paid back. And the lion's share of that would benefit countries like Italy and Spain that have been most heavily affected from the virus. An additional 250 billion euros would go to would be used for loans then, and it would also benefit mostly those countries who have been especially hard hit. But as you mentioned, not all members are on board yet. There are a couple of countries who are considered very frugal countries, and what they see is a spreading of money and a mixing of finances and fiscal policies that they don't really like. So it's going to be interesting in the next few weeks to see how this all pans out, if they raise objections that could be critical to this, or if they go along with it. At stake here is the single currency itself, so the stakes are very high.
All right, thank you, Steve. Stephen Barrett there, DW correspondent from Berlin. Thank you for joining us. And news just in is coming from Abuja, where a court has struck out charges against Senator Ademola Adeleke. Senator Adeleke was standing trial before the court over allegations of examination malpractices preferred against him by the federal government. Senator Adeleke was the governorship candidate of the People's Democratic Party in the Osun State governorship election in 2018. More than 200 schools in South Korea have been forced to close just days after they reopened due to a new spike in COVID-19 cases. Most of the cases have been linked to a distribution center outside Seoul. Health officials say the cluster of new outbreaks is a crisis situation.
Hundreds of schools in South Korea have closed due to a spike in coronavirus infections, just days after they reopened to millions of children. Most of the new cases are in Seoul. It comes after officials reported the highest daily rise in new infections in more than 2 months. After Japan lifted its state of emergency, there's been a small rise in infections in the south of the country. The national government has sent a response team to prevent it from spreading. Brazil, which is at the center of the Latin American outbreak, has also reported a surge in new cases. It said a record number of infections, more than 26,400, had been confirmed over the past 24 hours. And over in China, the country has again reported no new cases as U.S. President Donald Trump renews attacks on Beijing over the coronavirus pandemic. President Donald Trump called the virus a very bad gift from China. Moscow's authority have more than doubled the official death toll from COVID-19 in the Russian capital for the month of April. The city's health department now says 1,561 people died from the disease, not 639 as initially announced. Russia has had 380,000 confirmed infections, the world's third highest number, behind the United States and Brazil. And finally, in Lebanon, The security forces will begin issuing fines to anyone caught in public without a face mask. Passengers on public transport risk a fine of around $16 if they do not wear one.
And from the Nigeria Center for Disease Control, every new case is motivation to keep pushing, and each recovery is proof that we can get through this together. You can take a look at their website. It shows you a lot of updates, statistics, cases across the states. It's also the same updates coming in from the World Health Organization's website. You find the coronavirus disease situation dashboard, interactive map providing the latest global numbers by country, also on a daily basis. Our website, channelstv.com, has the latest news. All you need to do is log on, access news in health, politics, in Africa and around the world, all at your fingertips. www.channelstv.com. That's the COVID-19 update. We're back again at 6. Thank you for watching. I'm Millicent Walker.